2020 has been a pretty crazy year so far, and today I'm looking ahead to 2021, and we're going to review the best Medicare Supplement Plan options for 2021, so stay tuned. Hi everyone, I hope you are well. 2020 has not gone exactly how any of us expected it to. And we don't exactly know what's to come yet in 2021, but we do have information about Medicare Supplement Plan trends. So today I'm talking about the best top Medicare Supplement plans for 2021. My name is Stephanie Apt. I am a licensed insurance broker and Medicare professional, and I like to do these Medicare Supplement Plan videos each year to let you know which plans are the top plans that you should be considering if you're shopping for Medicare Supplement. These are generally the Medicare Supplement plans that are going to give you the best bang for your buck. And I'm also going to share two important money-saving tips that you really want to keep in mind when you're shopping for your Medicare Supplement Plan. So the chart on the screen right now shows you all of the standardized Medigap or Medicare Supplement plans for 2021. And frankly, this is a really confusing chart. There are so many letters and numbers and things to look at. So I want to go ahead and break it down and let you know what you really need to know about Medigap when you're going to choose a Medicare Supplement Plan. In truth, many of these plans that you see here are not even worth purchasing from a cost-benefit analysis. They don't even make sense to buy. There are only a few Medicare supplement plans that really make sense to purchase when you look at the cost of the plan versus the benefit it provides. And as if Medigap wasn't confusing enough, there are actually two plans here on the screen that are no longer available to newly eligible Medicare beneficiaries. Medicare Supplement Plan F and Medicare Supplement Plan C. Now, for a long time, Plan F was the most popular plan, and I talk about that plan a little bit more in this video up here, and I'll also link it in the video description below. Generally, I don't recommend Plan F even if you are eligible for it, except in very specific situations. And go ahead and check out that video in the description below if you want to learn a little bit more about the pros and cons of Plan F. So what plans do we recommend as the best value plans for 2021? The plans that are showing as the best value nationwide are generally Plan G, Plan N, and HighDeductible Plan G. Now, what about the rest of the plans? Should you be considering Plan K, Plan L, Plan M? In short, probably not. These plans are not very widely offered, and when they are offered, the cost versus the benefit ratio of these plans just doesn't make sense. So like I said earlier, we don't see very many people going with these other plans. Let's start off by talking about Plan G. Plan G is pretty simple to explain. You have 100% coverage on Plan G after you've met your Medicare Part B deductible. You see, everyone on Medicare Part B has a deductible. This year it's a $198 deductible. So you have to be responsible for that first $198 of your medical expenses each year. But after that, if you have Plan G, you have 100% coverage at the doctor and hospital. So there's no copays, no other out-of-pocket costs that you would see after that deductible's been met. So your hospital stay, your diagnostic testing, your office visits, chemotherapy, all of these things would be fully covered on Plan G after you've met that Part B deductible. So Plan G is a very popular plan, offers very comprehensive benefits. Plan N is another plan that is very popular. Plan N is very similar to Plan G, but there are two things that make it different. Now, both Plan N and Plan G require you to meet the Part B deductible. So you still have that $198 deductible on Plan N, just like you do on Plan G. With Plan N, you also have complete coverage after you've met that deductible, aside from two things: possible copays and possible Part B excess charges. So let's talk first about the copays. If you have a Plan N, you may be responsible for copays of up to $20 at the doctor's office, or copay of up to $50 for a standalone emergency room visit. And I'm going to link a video in the description below that talks a little bit more about the Plan N copays and when exactly you can expect to see those. Now, the other thing that makes Plan N different than Plan G is that it does not cover Medicare Part B excess charges. These are very rare charges that happen if you go to a provider who accepts Medicare patients, but they don't accept Medicare assignment, which means they don't accept Medicare's payment as payment in full. In these rare situations, a doctor could bill you up to 15% above the Medicare approved amount for that service. Those are excess charges. Plan G covers them at 100% and Plan N does not. Now, a study that I'm going to link in the description below showed that most recently 99% of Medicare claims did not have any excess charges, so it appears that they are quite rare. And in certain states, the ones you see listed on the screen right now, excess charges are actually illegal. So in those states especially, it's a really good idea to consider Plan N. The third Medigap plan that's growing in popularity is HighDeductible Plan G. This plan typically has the lowest monthly premium of any of the Medigap plans, but of course, being a high deductible plan has the most potential out of pocket that you may be responsible for. With a high deductible Plan G, you are responsible for your Medicare Part A and B deductibles and your Medicare A and B coinsurance and cost shares until you've met the high deductible Plan G's deductible for the year. Currently, the high deductible Plan G's deductible is $2,340 per year. So you'll be paying all of your Medicare coinsurance and cost shares until you've met that amount, at which point the high deductible Plan G would kick in at 100%. Now, high deductible Plan G can be a really good value in some states like New York or certain parts of Florida, where Medicare supplement prices are really high and it just makes more financial sense to go with the lower premium high deductible plan. And if you're considering going with a high deductible Plan G, you'll want to assess how comfortable you are spending out of pocket into that deductible, since you can't necessarily change your plan every year. And that brings me to my first important money saving tip. Medicare supplement plans are typically medically underwritten plans, and a lot of people don't realize that. This means that in most states, insurance companies can ask you a series of health questions and look at your health history, and they can either approve or deny your application for coverage based on your current health or your health history. Now, everyone gets one Medicare Supplement open enrollment period, and that happens either when you first turn 65 or you first go on to Medicare Part B. You get this one-time window, it's a 6-month window, when you can get any Medicare supplement plan you want with any company, and it's guaranteed to be approved to you. Now, after that window closes, in most states, you will have to pass through medical underwriting if you want to switch from one plan letter to another or from one insurance company to another. So in most states, it's important to think long-term about which type of Medigap plan and insurance company you really feel comfortable with. My second tip, and I've definitely talked about this in my videos before, is that Medicare supplement plans are standardized plans. So Plan G is the same exact benefit plan no matter what insurance company you buy it from, whether it's Aetna or United Healthcare or Blue Shield. It's always the same exact plan. And because you can always go to any Medicare doctor nationwide, it's the same exact provider network, no matter what insurance company you're with. However, different insurance companies charge sometimes vastly different prices for that same plan. So you really want to shop around and make sure you're looking at the different rates with the different companies that offer these plans in your area. And you don't want to base your decision on price alone, right? You do want to get a competitively priced plan ideally, but you also want to look at things like the financial strength and security of that insurance company. What is their customer service like? What have their rate increases been like in the past. So these types of things will really help you choose a good insurance company that can help you save money now and into the future. So this is exactly what I do. I help people find and enroll in the best Medicare supplement plan at the best value for their needs. I would be happy to assist you. I work in almost every state nationwide, so chances are we can help you. If you'd like a free no obligation quote for Medicare Supplement, please don't hesitate to give us a call. You can also send me an email and I would be happy to help. Thanks again for watching, and we'll see you soon.